Hi, my name is Jacqueline.
Hi, Jacqueline.
Nice
Welcome to the college.
you.
Nice to meet you too.
Hi, Jacqueline and Dr. Lee. Nice to meet you. Please have a seat.
Yeah. My name's Dr. Stark. I teach in the basic vision sciences. Dr. Lee teaches in the clinical program. I noticed you went to UCSD. Where do you live right now?
Right now, I live in San Diego as well. I'm just taking some classes that I haven't done for the units here.
Yeah.
So some of the classes like anatomy, take anatomy.
Yeah. And also noticed you've already visited before to an open house. Which one did you come to?
I went to the one in the summer. I think I went to 2 of them actually, and one in April possibly.
Yeah, that's good. Did you get a chance to see the campus when you were here?
Yes, I did. I took a couple of tours and I talked with Dr. Munroe and some of the students that were already here.
Good. Well, just to let you know about the interview, at this stage you've met all our academic requirements, and in the interview we're purposely not told about your academic records and scores and things. The purpose of the interview is to get to know you, understand more about you, find out what you're interested in and why you'd like to come here. Also, there's an opportunity for you to ask us questions and find out more about what the college is like. And we've read through your essay and your application, and we've written down things that we'd like to ask you about. So to start out, probably we should ask the important question, why optometry? Why not something else?
In college, I knew that I wanted to do something with healthcare and something with a business side. At first I wanted to be a CEO of something, but then you don't really get to interact with people. So I started doing research in my freshman year, and then in my second year I started doing a lot of shadowing, and with different like dentistry, pharmacy, optometry. And I think optometry is the one that appealed to me most. Yeah, so.
What appealed to you about
the lifestyle, definitely. I think that with optometry, it's a clean profession. I get to have a family of my own by setting my own hours if I were to do private practice. And after shadowing a lot of optometrists and seeing all the different ways that you can help a patient, not just giving glasses, but also checking their ocular health or doing contact lenses or vision therapy, that all interested me. So it seems like there's a lot that you can do with optometry.
So did you see those things like vision therapy and contact lenses in the practices that you visited?
Yeah, I saw a lot of them. I shadowed a lot of different doctors because there's a program at UCSD that allows me to just visit one person for one visit or a few visits, and they all had different types of practices.
Now I noticed you visited quite a lot of practices and even a university eye clinic. Is that right?
Yes, on campus we have something called the Shiley Eye Center, and it's the optometry-ophthalmology unit on campus, and they were doing a little research that I wanted to volunteer for to get a little bit of a better understanding. And the research was about kids and the prevalence of refractive errors. So we went around to different elementary and middle schools around San Diego to test their vision and their hearing as well. So I got a better understanding of, you know, if there's a lot of kids out there that can't see or if they have problems. So catching it early is good.
Yeah.
That's what I learned.
And what stood out for optometry that didn't stand out when you shadowed the dentist or the physiotherapist, say?
I think with optometry I was able to see that the doctor and patient interaction was a lot more than if it were with a dentist or a pharmacist, because optometry, you see them yearly or you see them when they come back, and then you get to understand where they're coming from as well as maybe them bringing their family. And so I saw that there was a lot of interaction. That's what I look for in a career.
Now you mentioned that you want to be a CEO. and so were you a business major or what kind
I
of
was
major
never
were
a
you?
business major, but when I was in high school and going into college, I knew that, you know, being in a business profession was clean and you got to wear nice clothes all the time in business casual. But and I know that I just want to interact with people in business. You do, however, when you interact, it's not always being nice. Sometimes you have to be cutthroat to be a CEO, I think, or just someone in that business. I don't think I could do that. So, but optometry, I know you don't have to be cutthroat. You can be genuine, you can be nice.
There are times when you have to give patients bad news. Would you be able to do that since that's an aspect of business you didn't like?
That is something that I'd probably be uncomfortable in the beginning, but it is a process that I hope to learn. And it is important for a doctor to give bad news because your patient is trusting you. And so I think that eventually I'll be able to find a way to give them the bad news in, I don't know, a less awkward way.
Okay.
Where do you see yourself in terms of the type of practice and perhaps even location?
I grew up in Northern California, but I spent most of my school years in Southern California, so either or, I'd love to practice there in California. And I see myself doing private practice, most definitely, either with a group practice or combined with co-management with the ophthalmologist possibly, or maybe just with one partner in the beginning.
Yeah. Okay.
Well, let me ask you this question. You've already told us what your goals are after you finish. Well, how about the beginning? So you gather your family and your friends together and you tell them, hey, I'm going to become an optometrist, I'm going to do optometry. And then one of them goes, optometry, what is that all about? What would you tell them and describe what optometry is all about?
I would say that it's not your just prescribing of glasses, because I know all my family, they go to an optometrist, so they know what it kind of entails, but we don't have any visual problems within my family. So I would say that there's a lot of other people, children, adults, who might have some ocular disease or some eye problem. And so it's not all about prescribing, but then also ensuring that the vision is there in relation to the overall health of the patient. And there's more to just glasses. There's prescribing of therapeutics now, and then there's glaucoma, and there's all these other diseases, or co-management with ophthalmologists. There's so much that you can do. It's not just this, and I would say it's better than the other professions.
Okay.
And you mentioned the overall healthcare of your patients. When you were working in the practices, did you experience some of those relationships between optometry and ophthalmology and other professions?
So when I shadowed a doctor who co-managed with TLC, I saw that their relationship was a good relationship. Whenever there was a patient who wanted to know a little bit more about LASIK or just some eye surgeries, and so he referred him to the ophthalmologist, and they talked about it a little bit, and actually went with the surgery, and then the optometrist saw the pre and post operative care. And I was actually able to go to the TLC center to see how the optometrist worked with the ophthalmologist. They did like the refraction in the beginning, and then made sure all the numbers were correct. And some of those things I didn't quite understand, but it was good, and I'd like to hopefully incorporate that in my practice.
That's a great experience to actually go and search for those those interactions, because they are important ones.
Mm-hmm.
Oh, I agree, totally agree. So, how did you get your research on optometry and what an optometrist does then?
In my freshman year?
In all your experiences, how did you know this is what you wanted to do?
We have a program at UCSD. It's HMP3. It's a Health and Medical Professional Preparation Program. And so you have all these different health cares, and optometry is part of it, and that's where I first got exposed to it.
Interesting.
Mm-hmm. And eventually I became an officer for it, so I was able to see all the insides, and we had a healthcare where all the different health cares went to as well, and optometry. S.C.C.O was there, and that's where I first learned about it, and then started just going out to different optometrists and asking if I could shadow them. And also in the HMP3 program, you have a mentorship program, and I had about like 4 or 5 that I was able to shadow.
Okay.
And then through one of them, I was able to get an internship, and then eventually a job. So it lasted for a while, and then I got to see the bigger picture of things.
And what about S.C.C.O? How did you research about the college, and what led you to apply here?
So when S.C.C.O came to UCSD to talk about it, that's where I first got the exposure. And that's when Dr. Munroe came as well. She comes, we have a lot of people to come visit during the pre-optometry clubs. And then I also found out that there was the admissions workshop and other workshops here as well. So I was able to visit the campus, like we said earlier. And all the questions I had, I asked Dr. Munroe and looked at the frequently asked questions on the website. So there's a lot of exposure from there, and I heard that this is really good for the clinical aspect. So then when I get out of the 4 years of optometry, I know that I'll be ready clinically, and you know, that's what I was drawn to, the clinical outreach programs, the different modes that S.C.C.O was interested in. You know, vision therapy, we have that at S.C.C.O, low vision, pediatrics, you know, everything is here, I think. Very open-minded S.C.C.O.
Well, I'm glad you came to one of our open houses. That's where you can get a lot of information. But did you contact any students here or any doctors who graduated from here?
I had a friend at UCSD who actually got into S.C.C.O the year before I applied, and so she was my avenue of asking, you know, what's it like there? Do you like it? Can you help me? I really want to get in. S.C.C.O was my #1, so I had to make sure I knew the ins and outs of everything. Yeah.
Have you applied to other schools?
I applied to 3 total. I applied to Berkeley, here, and SUNY.
Yes. And what are the attractions of Berkeley and SUNY?
Berkeley, which is near my hometown, I know that they're very, they're into research. They have a good academic program. I think all schools have a good academic program, but the one that I liked the most, my #1 was S.C.C.O because of its